Yuvafem Tablet is a medication that contains estrogen, a hormone that helps reduce vaginal symptoms of menopause, such as dryness, burning, and itching. These symptoms occur when the body produces less estrogen. When treating only vaginal symptoms, it's best to use products applied directly inside the vagina, like Yuvafem Tablet. Estrogens that are taken by mouth, absorbed through the skin, or injected may have greater risks of side effects due to more estrogen being absorbed. The recommended dosage and timing for taking Yuvafem Tablet should be discussed with your healthcare provider. Remember to always read the patient information leaflet before using Yuvafem Tablet. Your doctor will usually recommend using it once daily for the first 2 weeks, and then 2 times a week after that. The tablet comes with an applicator, so if it falls out before using, make sure to throw it away and get a new one. Gently insert the applicator into the vagina as directed and press the plunger to release the medication. Make sure to throw away the applicator after use. The dosage will depend on your medical condition and how you respond to the treatment. It's important to use this medication regularly to get the most benefit from it, so make sure to follow your dosing schedule carefully. Don't increase your dose or use it more often than directed. If your condition doesn't improve or gets worse, be sure to talk to your doctor. Some common side effects of Yuvafem Tablet may include nausea/vomiting, bloating, diarrhea, breast tenderness, headache, or weight changes. Remember, this medication has been prescribed to you because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, if you experience any serious side effects such as nausea/vomiting that doesn't stop, mental/mood changes, breast lumps, unusual vaginal bleeding, increased vaginal irritation/itching/odor/discharge, severe stomach/abdominal pain, yellowing eyes/skin, dark urine, swelling hands/ankles/feet, increased thirst/urination, chest pain, sudden/severe headache, weakness on one side of the body, trouble speaking, vision changes, trouble breathing, or signs of a serious allergic reaction, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. As always, follow your doctor's instructions and recommendations for the best time to take this medication and the appropriate daily dosage. Estrogens, whether used alone or with another hormone, can have serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment. Estrogens should not be used to prevent heart disease or dementia. Using estrogens can increase the risk of uterine cancer. Taking a progestin as directed by your doctor can help lower this risk. It's important to tell your doctor immediately if you experience any unusual vaginal bleeding. In postmenopausal women, using estrogens can increase the risk of ovarian cancer, stroke, dementia, and serious blood clots in the legs. When used for up to 7 years, estrogens alone do not seem to increase the risk of breast cancer. However, when used with a progestin, estrogens can increase the risk of heart disease, stroke, serious blood clots, dementia, and cancer of the breast or ovaries. The risk of serious side effects may depend on the dose of estrogen and how long it is used. This medication should be used at the lowest effective dose and for the shortest amount of time. It's important to discuss the use of this medication with your doctor and to have regular checkups, for example, every 3 to 6 months, to see if you still need to take this medication. If you will be taking this medication long-term, you should have regular complete physical exams, for example, once a year, as directed by your doctor. Before taking Yuvafem Tablet, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. You should also let your doctor or pharmacist know about your medical history, especially if you have a history of certain conditions such as vaginal bleeding of unknown cause, certain cancers, blood clots, stroke, heart disease, liver disease, kidney disease, high blood pressure, diabetes, high cholesterol, obesity, and many others. It's important to avoid smoking or using tobacco while taking this medication, as it can further increase the risk of certain health issues such as stroke, blood clots, high blood pressure, and heart attack, especially in women over 35 years old. If you have had or will be having surgery, or if you will be immobile for a long period, such as during a long plane flight, it's important to inform your doctor as these conditions can increase the risk of blood clots and may require you to stop taking the medication temporarily or take special precautions. Yuvafem tablet may cause blotchy, dark areas on your face and skin when exposed to sunlight, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may experience vision problems or difficulty wearing your contact lenses while taking this medication, so it's important to contact your eye doctor if these issues arise. It's crucial to avoid using Yuvafem tablet during pregnancy, and if you become pregnant while taking this medication, you should inform your doctor immediately. Additionally, this medication can pass into breast milk and may reduce the quality and amount of breast milk produced, so it's important to consult your doctor before breastfeeding while using Yuvafem tablet. When taking Yuvafem tablet, it's important to be aware of potential drug interactions. Certain medications and herbal products may interact with Yuvafem, affecting how it works or increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Some products that may interact with Yuvafem tablet include aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. Additionally, Yuvafem may interfere with certain lab tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you are taking this medication. As always, it's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Yuvafem tablet. If you or someone you know has overdosed on Yuvafem tablet and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. Symptoms of overdose may include severe nausea or vomiting, as well as unusual vaginal bleeding. Always take medications as prescribed and seek medical help if you suspect an overdose. It's important not to share Yuvafem tablet with others. While taking this medication, it's important to have regular physical exams and medical tests, such as blood pressure checks, breast exams, mammograms, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes, such as reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking, can help in controlling or preventing these diseases. Keeping your mind active with mental exercises, like reading and solving crossword puzzles, can also help prevent dementia. It's important to talk to your doctor about lifestyle changes that might benefit you. If you forget to take a dose of Yuvafem tablet, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at your regular scheduled time. Do not take a double dose to make up for the missed one. When it comes to storing Yuvafem tablet, it's important to keep it at room temperature and away from light and moisture. It's best to avoid refrigerating it and storing it in the bathroom. And of course, always remember to keep it out of reach of children and pets. When it comes to getting rid of any leftover medication, make sure not to flush it down the toilet or pour it down the drain unless specifically told to do so. Instead, it's best to properly discard the product when it's expired or you no longer need it. You can consult with your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.